The Surgeon General Jerome Adams is the nation's doctor. He's responsible for assessing the health of more than 300 million people in the United States. And he's concerned about what he's seeing here in Washington state.
At the Odessa Brown Clinic in Seattle, nurses are getting a lot of questions about measles and vaccines.
We get, can they be vaccinated sooner? Can they be vaccinated more than the times that they need to be vaccinated?
Wow. Dr. Jerome Adams, the U.S. Surgeon General, is here to learn more about efforts to get people vaccinated against preventable diseases like measles.
We know that the number one reason why folks choose to get vaccinated is trust in their provider and a strong provider recommendation.
A measles outbreak is underway in Clark County, where doctors are trying to quarantine people who may have been exposed.
We are in the fifth wave of the spread of this, so we are seeing, some hopeful signs of some slowing, but we're not out of the woods yet.
Higher vaccination rates would prevent measles from spreading, and the Washington Secretary of Health says there's been a big uptick in people, especially adults, seeking vaccines since the start of the outbreak. A legislative fix could also help prevent future outbreaks, Dr. Adams says.
The science tells us that states who have more than medical exemptions available have lower vaccination rates and are at higher risk for vaccine-preventable outbreaks.
Lawmakers just advanced a bill to eliminate personal or philosophical exemptions to vaccinating their kids. Meanwhile, doctors say the Clark County outbreak will likely smolder for weeks, if not months.
We will not know that we're out of the woods until 42 days after the last case is diagnosed.
The Surgeon General, the Assistant Secretary for Health and Human Services, and the Director of the Centers for Disease Control and Prevention recently published an op-ed article calling modern vaccines highly effective and safe. They say the country cannot be complacent, and they say this measles outbreak is a reminder that they still have a lot of work to do.
Gives you an idea of how big a deal they think it is if you got the Surgeon General coming out
at that level,
here.
yes.
Right. Thanks, Ted.